Hey guys, this presentation is on alcohol and drug intoxication, patient assessment and management. So alcohol. Firstly, it's a depressant, and so signs of intoxication with alcohol include aggression, emotional liability, slurred speech, ataxia, and transient hallucinations. In terms of signs of withdrawal, they're the opposite kind of what happens when they're intoxicated, so they become irritable, agitated, and dysphoric. So these are the typical symptoms. You also can get cold shakes, chills and sweating, fever-like symptoms, mood swings, anxiety and depression, diarrhea, insomnia, vomiting, and bone pain. Eventually, you can develop to delirium tremens, which has a 10% mortality rate, and these patients are at a greater risk of fatal seizures. Other stimulants. A stimulant is something that stimulates you, including methamphetamine and cocaine. Signs of intoxication include increased energy, pressured speech, disinhibition, maniac-like symptoms, psychosis, tremor, dilated pupils. Signs of withdrawal include irritability, agitation, anxiety, dysphoria, drowsiness, sleepiness, and trouble staying awake. Cannabis. Cannabis is a depressant. The signs of intoxication include having bloodshot eyes, being prickly, and being paranoid, being high, as well as being silly and giggling. And signs of withdrawal are quite similar to alcohol because they're both depressants. Opiates. Opiates are a depressant. Signs of intoxication with opiates include pinpoint pupils, altered mental state, slurred speech, on the nod, so waking up with a jolt. Signs of withdrawal include irritability, agitation, anxiety, dysphoria. They get this goose flesh and they have trouble staying awake, so very similar to alcohol as well. Benzodiazepines is a depressant, and signs of intoxication include drowsiness, slow speech, quiet. Signs of withdrawal are similar to alcohol. Hallucinogens. A hallucinogen includes LSD, psilocybin, magic mushroom. Signs of intoxication include psychosis and hallucinations, big dilated pupils, being hot and silly, and giggling. Signs of withdrawal include irritability, agitation, anxiety, and dysphoria. Management of intoxication. De-escalate, de-escalate, de-escalate. Consider hospitalization under the Mental Health Act 2007 for mentally disordered persons to provide a safe environment and minimize risky behavior. And assess a mental state exam when they're sober, but there's no place for psychological interventions. For those who have an acute intoxication, there are certain reversal pharmacotherapies which you can give them. So if they have an opiate overdose, give them naloxone. If they have benzodiazepine overdose, give them flumazanil. And if they have a tricyclic antidepressant overdose, give them sodium bicarbonate. You can also stomach pump and use activated charcoal in ED. However, usually this is used if they've injected it within the last 60 minutes, or the drug is a slow release, because usually it's absorbed by then. So here's just summarizing the 3 different drugs for overdoses: naloxone, flumazanil, and sodium bicarbonate. So in order to diagnose dependency, there's 4 criteria according to the DSM-5. First, they need to have tolerance, so they need an increasing amount to get the same amount of feeling. Withdrawal symptoms, cravings, and use despite negative social, interpersonal, financial, and legal problems. In terms of management of their dependence, you want to have a multidisciplinary care team and a biopsychosocial model of care, which basically stands for biological, psychological, and social. So let's just use alcohol dependence as an example, but this should be used for all types of dependence. So biological. In alcohol dependence, you want to treat the withdrawal symptoms with diazepine if necessary. You want to encourage compliance with drugs to treat alcohol dependence such as acamprosate, naltrexone, and disulfiram. You want to reduce the impact of alcohol-induced liver disease for them to see a cardiologist, gastroenterologist, or neurologist, depending on what they have. For example, alcoholic cardiomyopathy, chronic liver disease, and peripheral neuropathy from vitamin B12 deficiency. In terms of psychological, you want to treat their mood, anxiety, and psychotic disorders that compel individuals to drink. And antisocial personality disorder are those who reject rules, and sometimes for those who have alcohol dependence, they may also have this disorder. They may also have borderline personality, which makes them unstable, and they're more likely to take risks with drugs. In terms of social, you want to address the social reasons as to why they're addicted to alcohol.